which would be specific for Bundibugyo. There are no doses of this which are currently available for clinical trial. So this needs to be prioritized as the most promising Bundibugyo candidate vaccine. The information that we have is that this is likely to take 6 to 9 months.
Up next, the research blueprint is fully activated to fast-track vaccines and treatments for this outbreak and to speed trials toward use.
Research and development for medical countermeasures in this context we've been ongoing for many, many years through previous outbreaks. So as DG said, I would like to start before going into the R&D by saying that I think the important statement to make is that we must really scale up intensive care, patient referral pathways, and prepare for a fairly promising pipeline in terms of therapeutics. So there certainly is hope along the way. Clearly, we do not have any approved vaccines which would be specific for Bundibugyo. There are no doses of this which are currently available for clinical trial. So this needs to be prioritized as the most promising Bundibugyo candidate vaccine. The information that we have is that this is likely to take 6 to 9 months. Before that, there is another candidate vaccine that is being developed that is based on the ChAdOx1 platform, so the same platform that was the AstraZeneca vaccine, but with Bundibugyo as the insert. That is a collaboration between Oxford and the Serum Institute of India. They are manufacturing that as we speak, but there is no animal data to support that. And so it is possible that doses of that could be available for clinical trial in 2 to 3 months, but there is a lot of uncertainty about that, and it will depend on the animal data as to whether that is considered a promising candidate research vaccine for Bundibugyo.
Point that Vasi made. Our priority right now is to help set up the platform, starting with safe and optimized treatment center, good patient referral pathway to ensure that every single suspected case can be early detected and cared for while we are preparing for upcoming trial on promising candidate therapeutics. I think that's what is very important for everyone to remember, and this is being done.
Coming up, one experimental vaccine may be ready for trials in a few weeks if animal results are positive, while a strain-specific shot will take months.
Science-based and solidarity. For some time, we know what works. What works is contact tracing, monitoring those contact, isolation, and immediate referral. Give you an example, like Uganda has done an incredible amount of work in tracing all the contacts and putting them in an institution or home quarantine and monitoring them. So we encourage all contacts, and our recommendation, we'll hear from the emergency countries are doing point of exit screening. Both Uganda, DRC are already doing that. So in support of the activity done by Uganda and DRC, and going
on travel measures, experts warn against blanket bans, urging contact tracing, quarantine, and exit screening, and stressing Ebola is not spread through the air.
This humanitarian conflict area, supporting them is the best medicine for the entire world in support of solidarity of DRC. It's a complex, as DG said, hundreds of thousands displaced population, insecurity, travel restrictions. Countries have sovereign, they do their own risk assessment, but they do have to provide to us the justification and the rationale behind their mandates. And we are seeing more and more countries. But currently, our top priority is to work closely with DRC in ensuring all the contacts are traced and all the patients suspected are put in the clinical pathway in safe environment and with the best care provided.
I think it's important to remember and recognize how Ebola is transmitted. It requires direct contact with blood and body fluids of an infected person. So it's not casual contact. It's not airborne. I think we need to be aware of that. And this relates to travel restrictions, which are not supported under the IHR recommendations. And we've heard about contact tracing and quarantine.